The month of February is Heart Health Awareness Month, and the Prairie Heart Institute at Effingham's HSHS St. Anthony's Memorial Hospital, cardiologist Jessica Prange says, even if you don't have a heart condition, it's important to practice heart health.
Make sure you're checking in with your doctor regularly. Some of the people that get themselves in trouble are those that really don't go to the doctor on a regular basis because life is busy.
Prange says severe chest pains, pressure, shortness of breath, and sweating are symptoms you shouldn't ignore.
Time is heart muscle, so the longer you wait, the more damage that could be done. So the sooner you get here, the better.
So high blood pressure is known as the silent killer. So even if you're not having heart issues, to always get your blood pressure checked routinely.
Heart disease can happen at any age. Obviously, the older that you are, the more likely you are to have the risk factors.
And this was the case for Sophia Marquez, who found out she had a heart condition after battling with symptoms for years.
So when I was little and throughout high school, middle school, I was always passing out kind of randomly, unexpectedly.
Sophia's parents thought her unconscious episodes were either a nervous system or cardiac problem.
Luckily, kind of a blessing and a curse, when I was at the doctor's office, I passed out and I had an unconscious episode. I can't necessarily say if it was a seizure or not, but they were able to see on the monitor, the EKG monitor, that I was going into what's called heart block. And so my heart was skipping beats, and it might skip 5 in a row, and then of course I'm not getting blood in my brain and things, and that's what made me pass out.
After doctors diagnosed her with a cardiac disorder known as heart block, her family was relieved to find out her episodes could be controlled by getting a pacemaker that she humorously named Patty. But thanks to that device, Sophia's heart has stayed in rhythm. Sophia's disease has even driven her to work in the cardiovascular field today.
Having my own cardiac problems, that kind of triggered my interest to go towards that field, and so when I found out about cardiac rehab, I just fell in love with it, and it's a great job to be in, especially when I can relate to the patients a lot more than someone who doesn't have heart problems.